I'm going to explain why covered California rates have skyrocketed for 2026. If you're on covered California or health insurance in general, this is happening nationwide with the Affordable Care Act plans, and even employer coverages have been affected. Employers, I'm just going to touch upon this for 2 seconds. Employer coverages have gone up about 100, 200 to $300 within that range. And this year is just it is what it is kind of year in terms of shopping for health insurance. Now, with Covered California, because it's part of the Affordable Care Act, again, the Affordable Care Act is interchangeable with Obamacare. What's been happening is a lot of subsidies have been given out, extra subsidies at that, because of the pandemic. The American Rescue Plan of 2021 had the first bailout in terms of giving extra subsidies for people who didn't even deserve them. So I don't know if people remember the $0 Silver 94 cost sharing reduction plan, the $1 Silver cost sharing plan that they were offering to literally anybody in any income bracket. Now, they curbed that in 2022 by passing the Inflation Reduction Act, which still gave a lot of subsidies out during the pandemic to make up for what was happening worldwide, right? Now, what's happening now is, and even this past year, 2025, the Silver 73 plan on Cover California has given a $0 deductible. Historically, before, that was not the case. There was still a deductible there. But now these Silver 73 plans are turning into Silver 70 plans for 2026. Now, what does this all mean? Andrew, what does this mean? So if we're going from a Silver 73 plan to a Silver 70 plan, that means that deductibles are going back up to $5,400. Now, mind you, these are pre-pandemic pricing. The premiums are not. The premiums are unprecedented. The premiums are wild right now. The premiums are super high right now. They're scaling back on what they've given out during the pandemic period. So what does the government want? They want their money back, right? So this is what's happening now. And a lot of people have been affected. People who I feel for are the people who need an oncologist or need to keep going with their chemotherapy, or if they have been going inpatient for certain surgeries and had prior authorizations, and all of a sudden couldn't work and their income lowered. Of course, the subsidies can balance it out, but at the same time, people who are making $50,000, $60,000 have seen an exponential increase in their premiums, and it's not doable for certain people. So a lot of people this year have considered doing an HMO from a PPO plan, because PPO plans have skyrocketed. In California, it's generally Health Net PPO and also Blue Shield PPO. Those are the two major PPO networks that Cover California offers. A lot of those carriers have risen their premiums, and again, taking away those subsidies don't help either, because without those subsidies, we can't match the high premiums. Now, the people who have not been affected or for the most part won't feel like they have been affected that much, are people who are in a Silver 94 plan. Now, that's a small window of people right outside of the borderline of Medi-Cal limits. In 2025, it was 22,590. In 2026, it's going to be closer to the 23,000, and that's for one person. Of course, with the family, that's going to be closer to 31,000. Let's say a husband and wife. And then, of course, if you look at the federal poverty limit chart, the FPL chart, then that'll illustrate how many kids, if you have dependents, how many kids in the family are going to be calculated into the actual household. Let's say it's a household of 4, then at that point, it's going to be a different income amount. But a lot of people have just been affected. A lot of people, I feel for you guys that have been. I actually have been affected myself. So this is happening to everybody. Now, What you can do is, again, consider going from maybe a silver to a bronze policy, and even tacking on a hospitalization plan so that it doesn't seem so catastrophic when you're using a bronze policy and having to meet a deductible for a lot of inpatient, outpatient care, things like that, and also specialist visits as well too. There are ways to combat that. And again, if you bundle hospitalization plans, ancillary policies, that can soften the blow. So a lot of people are considering that option this year. Now, another way to think about this is your tax penalty is still in effect, right? So that's going to be $75 per person. Um, Now, a lot of people have been just going off of Cover California and going into alternative plans. Now, I would suggest you tread lightly on alternative plans, especially Christian health sharing plans, indemnity plans, because there's a lot of catches to them. Now, if you're not sure of the catches, please reach out to me and I can go over these with you, because this is what we do for our clients as well too. So, a lot of people are considering alternative methods. A lot of people are considering going down to a different a metal tier level. So this is just that kind of year to do so. I hate to be the bearer of bad news. Don't shoot the messenger, please. But this is just what's happening. So just wanted to give a quick explanation on what is happening and also some solutions. But again, if you want a customized answer for yourself, please reach out to me at 323-844-8471, and our email is also info@healthmutualnetwork.com. More than happy to assist with this if you did have any questions. But for the time being, I pray everybody is well during this time. And even though the government shutdown's over, they're still talking about what they're going to do with subsidies. Now, in my opinion, I don't think they're going to really do anything. If they wanted to do something, they would have already done it. But hopefully they prove me wrong. I'll see you guys at the next video. Thanks for watching.